I'm really excited to introduce Kelly Ray, who's one of our clinical psychologists who's here for her fellowship in pediatric psychology. Her specific interest is in working with our patients as they transition from pediatric care to adult care. And in that role, she's come across some of our patients who are in our home exercise intervention program, and she has been a really big ally, both to us as the treatment team, but also as to our participants as one of those members of their team, one of their supports to help them overcome barriers and think about the problems and the challenges that we're putting forward to these patients through a different lens. So I'm really excited to hear her talk for the first half of this hour. So Kelly, thank you.
Yeah, thanks so much for having me. So the topics for today, I'll be covering. I'll really briefly overview the importance of mental health and exercise in cardiac patients, and talk through some of the common psychological barriers to exercise intervention participation. And then I'll use two case examples that I'll highlight the use of psychology interventions, both in formal psychology therapy with me in conjunction with the exercise recommendations, and in one case, participation in Heart Club. And then we'll end that with tangible strategies for everyone to consider when looking to integrate psychology interventions into your practice. No formal psychology training or therapy experience required. So to start, I'm preaching to the choir here, but mental health and exercise are highly related to one another. We know this. And when we think about these behavioral determinants of exercise, these things that can either enable or act as a barrier to participation in exercise, these things overlap significantly with mental health concerns. I'll talk more in a minute about what some of those specific barriers are, and then we'll highlight these in the case examples as well. But a recent systematic review and meta-analysis found that among adults with mental illness, low mood and significant stress was a barrier and the primary barrier to exercise among over 60% of the patients that were recommended to engage in exercise intervention. So knowing the role that mental health plays in exercise, when we consider for our cardiac patients that we're all preparing for, teens and young adults with congenital heart disease experience 3 times higher rates of anxiety and or depression diagnoses compared to their healthy peers. This is also likely an underrepresentation from the COVID-19 mental health crisis that we are still in and recovering from. This is likely an underestimation of that, so keeping that number in mind. We also know that depressive symptoms are associated with lower physical and psychosocial quality of life among adolescents with congenital heart disease. So what does this look like, mental health and exercise link? So these are some of the primary psychological barriers faced when considering participation in exercise intervention or recommendations, starting with anxiety and fear, especially given changes in the last few decades regarding recommendations for exercise. You know, there may be some patients and families who were previously told not to exercise for their safety who are now being told to increase their exercise levels. This can lead to increased anxiety. And also if the experience of those physiological experiences during exercise, shortness of breath, increased heart rate, some of those questions around, are these normal responses to exercise versus something wrong with my heart, can lead to increased anxiety, fear, and then avoidance of the exercise that is being recommended to them. Another common psychological barrier, low motivation or unclear goals, which can certainly arise from low mood, depressive symptoms that can impact both the energy and the motivation to engage in the exercise, and then poor habit formation and the need for increases in supports and building those routines and those habits related to exercise to even just get started. So there are several formal psychological interventions that are helpful in both conceptualizing and supporting exercise participation in the context of mental health concerns. First of which is cognitive behavioral therapy, or CBT. And most people have at least seen that acronym. So CBT is really centered on this idea of the cognitive triangle, that's depicted in this image here. This foundational idea that our thoughts, our feelings, and our behaviors are all linked together. They can enhance or hinder one another. And related to exercise participation, CBT can be very helpful in addressing some of those negative automatic thought patterns related to their exercise or themselves or their abilities, as well as supporting more adaptive behaviors that can be used prior to or during exercise engagement. I'll talk through several of these strategies in the case examples, but some of these exercises can be identifying negative automatic thoughts that patients are experiencing during exercise or before exercise, relaxation strategies to help some of those physiological experiences, and then thinking about exposure to the physiological experience of exercise as an intervention in and of itself, when avoidance is one of the primary things impacting participation. Other psychology interventions to support this, which really go hand in hand with one another: motivational interviewing techniques, or MI, referred to as, and acceptance and commitment therapy, or ACT. Both of these interventions really focus on enhancing intrinsic motivation of our patients to engage in exercise and enhance their commitment to the changes that we're asking them to make or that they want to make for themselves. Different strategies for this is even just starting off with identifying what their values are that can be really individualized to them, and then supporting them and engaging in behaviors that align with those values and those goals. So, for example, maybe their big value or their big goal is not wanting to increase their exercise, but they really want to travel. And so how can you frame exercise as moving them towards this bigger goal, rather than just something that our team or that their cardiologist is recommending them to do? Lastly, another big intervention strategy: goal setting, self-monitoring, particularly using this SMART goals framework, that goals are specific, measurable, attainable, relevant to them, and time-based. I won't go into as much detail about this today, but I'm familiar with this structure, but some practical tools for helping to build those consistent habits and identify clear goals as you're moving forward. So moving into our first case examples, this one will focus on CBT strategies. So I'll introduce you to Michael. So Michael is 20 years old. He was newly diagnosed with hypertrophic cardiomyopathy. Prior to this diagnosis, at age 20, he was very active. He played football in high school. He worked in construction over the summers, and has since received this diagnosis. He now feels very weak, very fragile, per his words, and has started experiencing panic attacks and avoidance of any activity, and is not leaving his house due to these kind of hypervigilance to his heart symptoms and fear that a medical emergency could happen outside of his home, and he would not be able to get the care that he needs. He, at the time of his referral to me, he had multiple emergency department visits for what was attributed to physiological symptoms of anxiety that he was interpreting as heart symptoms, and was coming to receive what he thought was emergent cardiac care. His cardiologist did recommend moderate intensity exercise for at least 30 minutes, about 5 to 7 days per week. He was certainly not doing this when he was referred to me by his cardiology team. And the goal would be to support his anxiety and move him towards engaging in these goals and other activities that had really fallen off as a result of this. So utilizing the CBT framework that I had already mentioned, our treatment to date, still in treatment with me, but our treatment to date really started with psychoeducation regarding both exercise is important to his heart health and very consistent with what his cardiologist recommendations were, but also that this was really serving as an exposure to those physiological experiences and increasing his anxiety. And so having that framework that it can be both of those things. So we engaged in identifying negative thought patterns, these automatic things that for Michael were mostly future telling, that he could predict what was going to happen based on what he was experiencing now, catastrophizing, really seeing this negative filter, discounting the positive things or the good things that were coming from exercise. And once we had those patterns identified, then we were able to focus on challenging those thoughts, identifying which of those thoughts were true, which ones were maybe less true, and if they were true, were they helpful, and being able to replace some of those thoughts with some more helpful thoughts for him. So reminding him that his cardiologist wants him to engage in the activity, but it is safe and necessary. And so having that, those reminders for himself as he was thinking about engaging in more exercise. And while he is thinking about doing that, as he's interpreting those physiological experiences as dangerous, how accurate is that in the context of his anxiety as well as his cardiac care? When considering his panic experiences and framing engaging in exercise as this exposure to those physiological experiences, and sometimes really works too on relaxation strategies, managing his panic and anxiety through grounding techniques, while also kind of identifying some of those triggers for his panic and reframing kind of panic management as kind of getting through that panic moment versus fighting that panic and interpreting that as dangerous and something that needs to be actively fought against. So in terms of his response to treatment so far, he's been engaging in at least some physical activity several times a week. He's been walking outside a mile at a time, leaving his house to walk that mile. It cannot be, understated how big of a change that was for him. He's also increased his time just spent outside of the house in general. He was able to re-engage in person in his college courses for the last few months of his college semester, and then he'll be starting a summer internship in just a few weeks, actually, outside of his home for 5 days a week, 9 to 5, which is a big change for him. He, while he'd not had a panic attack in several months, he actually did have one within the last few weeks after he was doing pretty intense yard work outside, one of the 90-degree days that we had here a few weeks ago, and had some other kind of familial stressors going on. So we spent a lot of time kind of processing that panic attack, creating kind of a panic plan for that, and kind of reframing that this is the thing that happened and it doesn't have to set back the progress that he's already made. And so just allowing him to even continue the progress that he's been doing versus letting that panic attack kind of take him multiple steps back is already a huge improvement to having multiple panic attacks from when he started. So kind of big CBT takeaways to start. So acknowledging too that exercise is exposing to potentially anxiety provoking physiological symptoms, and that this is actually a helpful thing maybe when wanting to increase exercise participation in the context of increased health related or exercise related anxiety, and showing themselves that they can do it and can get through those experiences with anxiety, but having develops the tools to be able to get through those things, relaxation strategies, cognitive restructuring, and really emphasizing that exercise is safe as a form of kind of challenging those negative automatic thoughts, but also making sure they understand why we're recommending the level of exercise that we are is a form of challenging some of those automatic thoughts too, filling in some of those blanks as to the whys. So moving on to the next case example. This one will focus on motivational interviewing and those ACT strategies. So Allie is a 26-year-old with hypospadiaplegia, hypoplastic right ventricle with atrial septal defect, status post-Fontan. She has comorbid mental health diagnoses of major depressive disorder, generalized anxiety disorder, ADHD. These were prior to her referral to me that she had received those, as well as increased general psychosocial stressors, which really exacerbate her mental health concerns. She was previously training to be a yoga instructor. She had consented to a heart club here at Michigan and began psychology therapy right at the same time. There have been, challenges with consistency and attendance for both of these interventions, which I'll speak to, as well as a lot of difficulties and considerations around her transitions in life and transitions to adulthood in general. Allie was really asking herself kind of throughout our time working together to what am I doing, what's coming next, and how do all of the decisions and behaviors that she's doing now set her up maybe for some of those future things. Using these ACT principles, we started treatment by identifying her values. So we use a commonly used ACT strategy, this values card sort. It's like a list of different things that people can find important or valuable in their life, and ask them to make a series of decisions of which of these things is more important to you. And you kind of end with this culmination of, between 5 and 7 things that are kind of those core things for you. For Allie, these were giving back to others, happiness, having structure and routine in her daily life, practicing gratitude, and then moving towards financial stability. So from here, once we had these core things, these things in her own words, these were not things that I came up with for her. These were things that she identified as important. We were able to kind of focus our discussions on bringing her behaviors, her decisions, including those things related to exercise, back to her values, her motivations, and how were her exercise and also other health behaviors that were really we were linking together throughout. How do those things currently move her towards or away from some of these values? A big one for her was noticing that her mood was improved when she was engaging in regular yoga. And that was one of her values. So you feel happier when you're doing these things. What does that tell you? And really kind of giving her the skills to kind of be her own therapist along the way. So, and it's easy enough to set goals, but actually following through with them can be a whole nother animal. So using motivational interviewing strategies with Callie, certainly expressing that building any kind of habit is hard, especially exercise habits, but also kind of building some of this discrepancy and what was her current level of exercise versus where she wanted to be, and really acknowledging that both there's why is it not as high as it could be, and also why is it higher than it could be. So why were you a 6 out of 10 and not a 2 out of 10? Because then that kind of gets to some of that change talk of I want to do this because of these reasons, and not just that, well, why aren't you a 10 out of 10 of why you want to do this. So kind of it leads to more of a fruitful discussion and a real acknowledgement of some of the barriers and challenges that can get in the way. And ultimately bringing it always back to her values and her whys. So in terms of Allie's response to treatment to date, she's also still in treatment with me, but she was lost to follow-up for Heart Club temporarily. She re-engaged after several months, completed several visits, ultimately lost to follow-up again for Heart Club, but she did have improved exercise testing during a recent ACHD clinic visit. She's had somewhat regular attendance in therapy. I say somewhat, but some improvements in managing mood and stressors, and again, all of these behaviors and decisions. And when she does reemerge back, we bring it back to those things. And this was important to you. Why you're back now? What is leading to that? And so, kind of keeping that framework throughout, because ultimately these are adults and they can make their own decisions as well. So big takeaways for kind of this MI ACT framework. Big one is really this their whys. What are their whys for increasing exercise? Not their parents, not their medical team, especially for pediatric patients, not their parents' whys or their caregivers. And being able to think flexibly about what those whys might be. It could be travel, but how can we bring those things in a way that moves them towards the other health behaviors and things we want them to be doing. Something less commonly explored, like I talked about, is both the ambivalence to change, those reasons to change and those reasons not to change, and having those open conversations around barriers and challenges that leads to more fruitful kind of problem solving. So for each of these examples, these patients have been in therapy with me for many months. They've had lots of sessions with me, but certainly there are ways to integrate some of these strategies into anyone's practice. Like I said, no formal psychology training needed.
But they still need us.
But they still need us. Yeah.
To clarify.
Yeah. So one of these is really reminders of the why, incorporating these tangible reminders of that into day-to-day lives. Phone backgrounds with a motivational quote or a picture of where they want to travel to or what college they want to get into, whatever it may be. Having those physical reminders daily. If you have vision board, pictures, quotes hanging somewhere that's really visible, sticky note on a mirror to be like first thing in the morning to set up some of those reminders first thing off the bat, building some of those habits, building some of those routines. Another behavioral strategy, pairing the fun and enjoyable activities with those less fun things, helping kind of build in some of that motivation. Also related to low mood, especially if low mood is getting in the way, how do you pair something that is enjoyable or behaviorally activating with this other thing? having to listen to a podcast or an audiobook or a preferred show on the treadmill only when you're doing that exercise time. Having an accountability person, a friend, a family member, or rewarding yourself after that exercise can be really powerful, especially in those instances of low mood, low motivation. When thinking about supporting exercise-related anxiety, so incorporating relaxation throughout the beginning, throughout, after a workout, pairing that with some deep breathing or meditative activities in addition to stretching, Calm app, or there's lots of other relaxation apps, YouTube videos that can kind of guide through even just a minute of deep breathing if they are kind of noticing some of that increased physiological symptoms before exercise. And certainly thought challenging and as simple of a way as the reminders of that this is safe, this is why you're recommending the level of exercise that you are, and kind of reminders that are specific to them of why these are being recommended and why it's okay for them to engage in those things, making sure they have that clear understanding of why the level of exercise is being recommended that you are. I know we didn't talk as much about building routines, but certainly, there are big phone apps these days that can help kind of monitor routines, engage in self-monitoring. Anyone who's been around a teenager these days who has Snapchat knows like the power of the streak. And so like how any of these apps or these reward charts can like monitor these streaks. And then especially for our younger crowd, sticker reward charts and like little tangible rewards at the end are ways to kind of keep up with those things. But as Melissa mentioned, certainly there are mental health, concerns that cannot be fixed with a sticky note on a mirror. So given the prevalence of mental health concerns among cardiac patients, always important to know how to find support, find additional support and mental health supports when needed. So one of which available here at the Congenital Heart Center, embedded mental health providers. We'll talk more about what that looks like here in a minute. Patients can also be directed to their primary care provider who might be able to provide local resources as well as potentially prescribe psychiatric medications if they feel comfortable doing so. Certainly they can call their insurance, see who's in network locally. Oftentimes there's an online portal that you can use, or psychologytoday.com allows you to filter by geographic region, language, insurance type, another source that could just kind of generate a list then for patients and families to use. So here at the MCOPE program, we have kind of robust psychosocial services available. 5 social workers, 4 faculty psychologists. This covers heart failure and transplant, single ventricle, fetal and interstage, and 2 cardiac neurodevelopmental as well. We also have a cardiac psychology fellow, that's me, covering ASHG and transition, 2 education specialists, 4 child life specialists, a parent and peer mentor lead, as well as a young adult peer mentor. But even with this level of support, there's always more needs, so we're continuing to kind of expand our offerings and services available. I'll leave us with one last, maybe, nugget of motivation.
This is actually really cool. I found this on Twitter. It's a school project. You can call this number and you will get a motivational message from a kindergarten. An incredible project. So I'm going to call the number and let's see how it goes.
Something you might have heard about.
Welcome to a public art project for
that gives you a pep talk.
If you need pep talk from kindergarten
class.
If you need to hear kids laughing with delight from sports.
And also very heartwarming. So I encourage you to call the number, experience it for yourself.
If you need words of encouragement and life advice, press 2.
And this is also
if you need pep talk, be grateful for yourself.
For us to use. Also,
live it up.
Use it with
be you.
And on that note, thank you all for listening and for having me a part of this session. It's been really great, and I welcome any thoughts or questions.
Yeah.